Hey guys, we are back and we're going to be diving into Medicare Supplements or Medigap plans. Now, depending on who you're talking to, some of you guys have talked to friends and they'll say, I have a Medicare Plan F plan or Medicare Supplement Plan F, or I've got a Plan G or Plan N, or maybe they say, I've got Medigap coverage, or commonly known as Medicare Supplement Insurance, referred to by a letter like Plan F, G, or N. All of those mean basically the same thing. That can be very confusing. We also get calls all the time where people call and say, I want a Medicare Supplement plan like my friend has. And I say, okay, great, explain your friend's coverage. And they'll say, well, they have a plan where they go to the doctor, they pay a copay, they have dental, hearing, and vision, and they don't have a premium, and that's what I want, a Medicare Supplement like theirs. And so we pause and say, okay, great. That is called a Medicare Advantage plan. And so what I'm going to do during that process of talking to somebody, I'm going to back them up and say, let me go over how the basics of Medicare, A and B, and then Medicare Advantage, Medicare Supplements work. We compress all this type of training down into probably about 10, 15, 20 minutes, depending on the person's question. We simplify that down in a way that makes it very easy. A and B unlocks the door to enroll into a Medicare Supplement. You need to have Part D or drug coverage, or you're going to be penalized. The risk of exposure to medications can be very high. We typically encourage people to choose a Medicare prescription drug plan unless they're a veteran or some situation where they're getting their drugs through some type of other coverage that they already have. Then we explain Medicare Advantage. So in this process, if you call in and say, I need a Medigap or Medicare supplement and my friend has this, and all of that just for us means we start at the beginning, walk you through, and make sure you're educated on the different health plan options. So to dive into Medicare Supplements, one of the big things about Medicare Supplements is it's private insurance that you buy or purchase. So it works a lot like life insurance. If you've ever had a life insurance policy, a couple of factors that drive that life insurance policy to perform is if you pay the premium monthly, you own the policy. The policy never lapses or cancels on you, or they can't cancel it on you if you pay the premium. Well, Medicare Supplement's the same way. It won't lapse, you don't have to renew it. You pay the premium, you own the policy. You own the policy to perform according to what plan option you've chosen. We're going to cover the three main ones that most people enroll into. That's Plan F, Plan G, and Plan N. Now for you guys turning 65 right now, from January 1st of 2020, MACRA created this, and I'm not going to dive into what MACRA means right now, but basically there was this ruling that came down from the government that just said anyone turning 65 years of age from January 1st of 2020 and beyond, the Plan F and Plan C of Medicare Supplements, those people are not eligible for Plan F or Plan C. They're eligible for all the other numbers that are available, which we're going to cover G and Plan N. But the Plan Fs for anybody prior to turning 65 of January 1st, 2020. So if your birth date, you're 69 years of age right now, guess what? You still qualify for Plan F, Plan G, Plan N, Plan C, or any of the letters that are eligible, that are available for Medicare Supplements right now. To keep that simple for you and to make life easy for you, one of the things I would encourage you to do is not try to complicate what plan do I need to do. Call, have a review done. We're going to walk you through when your birth date was and what plan you're eligible for. But if you get around a friend that says, I'm on a Plan F, you should get that. And you call us and you say, I want a Plan F just like my friend. They have this carrier. Is that the best carrier? We're going to walk you through doing a quote for your area. Insurance is driven by zip codes. So your friend may be in a total different state or zip code, and we may do a quote and find that their plan is going to be a higher cost for you, and another insurance carrier would have a lower premium cost. We also look at these moving factors on the historical perspective of what that carrier has done over the last 4 to 5 years in rate increases. Medicare Supplements, when you enroll into a supplement, regardless of the supplement, they're going to have a rate increase each year. Sometimes it's at the first of the year. Sometimes it's on your birth date. Sometimes they can have a group rate increase across their entire book of insurers. And then you still have your rate increase, either the annual or your birth date rate increase. Depending on the carrier, Again, you don't have to know all that. That's part of what we do. It's just saying, hey, your rate increase is you're going to see that on your birth date. You'll get notification, and this is what's going to occur. You're going to have rate increases. So your rate starts here. As you get older, the rate goes up. Now, we typically like to say we like to shop rates every 4 to 5 years for our clients that are on Medicare supplements. So as your rate increases, certain carriers like to insure people at certain ages. So let's say somebody has really competitive rates at 65 to 67. Once you get around 69, you realize your rate's kind of jumping up. Sometimes carriers like to have people from 68 to 72, and they have really, really competitive low rates. Every insurance company rates out how they like to rate people when it comes to their risk and exposure and things like that. So their rates can be lower for certain classifications of ages. So what we like to say is every 4 to 5 years, call in, or we call you. We want to do a review of your Medicare Supplement rate and see if we can lower your rate by putting you on an insurance carrier's plan that has a lower rate. It kind of takes your rate from being here, lowers it down, saves you money, and then it starts over again. That carrier is going to increase their rate as well. So we're going to cover really, how do you get into original Medicare Part A and Part B, and then how do you get into a Medicare Supplement? One, you have to have Medicare Part A and Part B to enroll, or have that key that unlocks the door to enroll into a Medicare Supplement. And also, what does that supplement cover? The cost basically that you pay for the supplement, because you're going to have a premium when you go on a supplement, it's going to pick up portions of the healthcare costs that original Medicare does not cover. So the deductibles and the co-insurance of the 20%, depending on the plan that you go into, it's going to pick up the deductible for Part A, always 100% for Plan F, Plan G, and Plan N. For Plan F, it's going to pick up the Part B deductible and the 20%. So F is Cadillac. It's going to cover 100% of the cost that Medicare doesn't cover. So if you go to the hospital under original Medicare and you have deductibles and co-insurance or any cost share left over, the Medicare Plan F plan is going to come along and pick up those costs 100%. The Plan G of Medicare Supplements, Plan Gs are going to cover Part A deductibles, and then the Part B deductible, you're going to pay out of pocket. So whatever that year's Part B deductible is, you'll pay. Like right now, it's $203. And then the Part G Medicare Supplement is going to pick up 100% of the 20% cost that's left over that original Medicare Part B services don't cover. So Medicare covers 80%. The supplement's going to pick up the 20%, and you're going to only be exposed to the Medicare Part B deductible. Now, depending on the premium, the area that you live in, and your age determines whether or not we look at a Plan F or a Plan G and determine what plan option is going to be best. But the Plan A is a Cadillac. Plan G is really like a step down, or an equivalent. Depends on how you look at it, and that's determined by premium, because you may have a premium that's much less than a Plan G, and it justifies going on a G rather than an F because the premium savings is more than the Part B deductible. Again, that's a little bit of math that we do with you on paper just to show you which plan would be best to save you the most money, and depending on the area that you live in. Now, the Plan N, the difference in the Plan N is basically it works just like the Plan G. You're going to pay the Part B deductible. Medicare, the Medicare Supplement Plan N is going to pick up the 20%. But doctors can charge up to a $20 copay for doctor visits for primary specialist. ER visit, you can be charged an excess charge of up to $50 copay for your outpatient services like ER as well. Outside of that, the Plan N is going to pick up 100% of all the other 20% charges, and you're not going to be exposed. Now, you must have Part A and Part B. A lot of times people get confused. They'll have Part A. They're coming off an employer plan. They say, I don't want to pay for the Part B. I want to go on a Medicare Supplement because it works just like my employer plan. And we say, well, you have to have Part A and Part B to really unlock the door to enroll into a Medicare Advantage plan or a Medicare Supplement plan. So for either of the plan options, you have to have Part A and Part B to enroll. Now, Part D, just the prescription drug coverage, if you're just enrolling into a prescription drug plan, let's say you're on an employer plan, you have Part A, you have an employer plan, but the employer plan is going to drop your prescription drug plan after you turn 65. It just may be part of how their employer's plans work. You call us and say, I'm not going to have drug coverage. What do I do? Well, a Part D plan, you can have Part A and or Part B. Just as a reminder, Part A and or Part B to enroll into a prescription drug plan. But otherwise, with the Medicare Supplement, you're going to have to be enrolled into Part A and Part B. Again, Plan F, Plan G, Plan N, it's going to pay for 100% of the deductibles and coinsurance, or it's going to pay basically all of the 20% cost and leave you exposed to the Part B deductible, which is a small amount. Plan N, again, can have an excess charge that the doctor can charge you up to a $20 copay for medical services, or for like ER or outpatient services through like the ER, it can be up to a $50 copay that you may have to pay as well. Again, just a reminder, Medigap, Medicare Supplements, Plan N, Plan F, Plan G, depending on the terminology your friends and family are using, that is all in the same bucket under Medicare Supplements or Medigap insurance. There's no difference between Medigap and Medicare Supplements. So, covering cost and a couple other things that I want to cover with you. A lot of times people will say, like, we'll deal with widows a lot of times, and they've been on an employer plan. The employer is eliminating that plan. So they've been on, like my dad was in this situation. He retired from TVA as an electrician. He had Medicare Part A and Part B, and he had retirement insurance and prescription drug insurance provided through TVA's retirement plan. He paid basically like $100-something a month for his premium, and it covered 100%. He had a Plan F Medicare Supplement with Blue Cross Blue Shield, and then he had a different Part D plan depending on who they contracted with, and he had extremely good prescription drug coverage. He was on a lot of high-cost medications with inhalers, breathing medications, and things like that, but he paid hardly nothing for his medication. Well, TVA eliminated the retirement program, and I had to go over and sit down and enroll him into a standard Medicare Supplement Plan F. He paid a premium for. TVA provided a stipend to retirees, and so basically he was getting paid to have the insurance deal. But then he had to pick up a prescription drug plan. The cost of that prescription drug plan for his copays, because it's just our standard Medicare approved prescription drug plan at that point. It's not a retirement plan. It's not an employer-based retirement plan. There's all of a sudden a standardized prescription drug plan. His cost went up in his medication. And it was like very, frustrating for him, because he felt like he had earned this right to retire from TVA and have the retirement benefits, and they changed. So if that's your situation, every situation dealing with a Medicare beneficiary can be a little different. They usually fall into certain buckets that we've dealt with retirees coming off a retirement plan, or if you're just aging into Medicare and you're going to go on a Medicare supplement, depending on your age or your birth date is going to determine whether or not you can qualify for F, G, or N. Or if you're looking at one of the other options and you throw that out at us, we'll explain that option to you or enroll you into whatever you want. But sometimes there's higher risk out-of-pocket cost for those other options, and most people choose an F, G, or N plan. So just keep in mind that you're paying the premium, the policy is performing, and it picks up what Medicare doesn't cover. The only exposure could be the deductible for Part B. And again, if you're on a Plan N, you can have some excess charge copays up to a certain dollar amount. Here's the beauty of why a lot of people love Medicare Supplements. Medicare Supplements, most doctors, almost all doctors contract with Original Medicare. All hospitals contract with Original Medicare. Almost never do you meet a doctor that doesn't take Original Medicare. Now, there are private service doctors that charge you a monthly charge and then provide service to you, and they don't take any insurance. If you go to a doctor like that, they're not going to be contracted with Original Medicare. You can choose to pay that monthly service and see that doctor, but typically you're going to go to most doctors, specialists, hospitals, anywhere in the world or anywhere in the U.S., and there's not a network that drives Medicare Supplements. So if the doctor takes Original Medicare and the hospital takes Original Medicare, regardless if you live in Tennessee or if you're getting care outside of Tennessee in any other state, and a doctor wants to send you to Dallas to have a specialist look at a a cancer situation with a specialist there, you can go anywhere in the U.S. with Original Medicare and a Medicare Supplement. There is no network and no restrictions of those networks beyond. They just have to accept Original Medicare Part A and Part B. Again, your coverage is guaranteed renewable for life. You just pay the premium. So explaining the supplement is Medicare Part A and Part B over here leaves you at risk for monies that's going to come out of your pocket. When you have Original Medicare Part A and Part B and you go onto a Medicare Supplement, it lowers the risk drastically for a very small amount of premium each month that you pay for the Medicare Supplement. So your risk exposure really is just subject to how much premium you're paying. The average person is probably paying anywhere from $1,500 to $2,400 of premium a year. Most people that are aging in right now are paying $135 to about $145 for their Medicare Supplement and their prescription drug plan. So really the risk exposure is just the premium they pay. And then if they're on a Plan G, the deductible, Plan N deductible, and up to a $20 cost for going to the doctor of $50. So very low exposure on a Medicare Supplement, and it opens you up to not have to be subject to the doctor networks that Medicare Advantage plans are. And if you like to travel, if we have a client calls in, they travel a lot and they have a very active lifestyle and they have a home maybe in 2 other locations, they live here. If you're living outside of the state or the county that you're in, typically you cannot enroll into a Medicare Advantage plan. You would have to be on a Medicare Supplement plan to be able to do that and still have coverage, because the Medicare Advantage plan has guidelines or a sandbox that you have to play in to be on that Medicare Advantage plan. So that is very important to understand as well. Now, I covered a lot with Medicare Supplements. There's a lot more that we could cover, but I wanted to condense that down to simplify it. You guys are going to probably have some questions about premiums, about your friends, your family, what they say. Maybe you're trying to get more education on the different options. My encouragement to you guys now is to be able to take a list of your medications, a list of your doctors, reach out to us with the number we provide you. Let us do what we call a Medicare review to walk through the basics of Medicare. We're going to take everything that we've been going over in a very deep dive. We're going to simplify that down in probably in less than about 20 minutes with you. We're going to take your medications, your doctors, put it into our platform. Then we're going to do a review with you to walk you through and specifically guide you toward what plan will meet the needs of the things that you require of your health insurance. And everyone's situation is different. We treat you individually and allow you to understand your options, and then choosing an option that's going to meet your needs. And then as the future ahead, we're going to service you as a client. And then if you need to change plans, you're able to come back to us. And it really does this. It eliminates you having to be subject to TV advertisements, phone calls, and all the junk mail and all the solicitation that comes at you as a Medicare beneficiary. As you age, you want to eliminate the complications. You want to take less stress off the table. You don't want to add stress to the table. And so we usually tell our clients, once you're a client for life for us. We want to serve you until your toes turn up and you close your eyes and you don't wake up again. And really that's what you need in your life, is somebody that's an advisor when it comes to your health plan options, just like maybe you have an advisor when it comes to your finance and your investments and things like that. Somebody that specializes and is a professional in that niche. Your health is important to you. We realize it is important to you. We also realize that trust and value and character and dealing with somebody that has these attributes of character that really know that allows you to really trust that person is important to you. And we would like to be able to have that opportunity to serve you guys. Really, we understand Medicare is extremely confusing. We're here to be able to make your life easy by making Medicare simple. Guys, reach out to us. We'd love to be able to help you. Also, check out some of our other information and materials we have. We encourage you guys to sign up for our Medicare Mondays for seniors that are provided every Monday. It's less than 5 minutes for bite-sized information about Medicare to make your life easy by making Medicare simple as well. We'd love to be able to talk to you and talk to you soon. Thanks a lot.